Breathing is what we do in life, in and out. And when Lamaze and Bradley method started to teach breathing, Lamaze breathing isn't sustainable, adjustable, or adaptable because it's for hours. You can't do it. And Bradley was in the nose and out the mouth, but it could sound so different from to and so we were coming up with a greater range of skills that are now birthing better skills. In the first video in this sort of mini series, we talked about how we discovered that humans have 4 ways that we breathe, and that each of those ways has variations. But only 2 of those ways have variations which are applicable to using breath in an adjustable, adaptable, and a sustainable manner while you're doing the activity of birthing your baby. So you want to refer back to that video, and the link is below. But what we discovered was knowing how to use a more relaxed breathing, even though we felt tremendous discomfort or pain, even though things were being done to us and around us we didn't like, and where we wanted to react to those things, and that would be reflected in our breathing. We realized that being able to relax while breathing wasn't sufficient. It took us 10 years to really develop this next skill called directed breathing, because when these skills developed in the early 70s, 5% of women were having cesareans because it was major abdominal surgery to save our lives, whereas the rest of us, 95%, labored because there was nothing anybody really could do about it. And that laboring didn't mean we had good outcomes. It didn't mean we had great births. It didn't mean that we had reasonably length of time labors. We just all labored because we couldn't do anything about it. But in the 1980s, that changed. And the biggest change came from societal demand from us as women. Because we now had access to birth control, safe abortions, we wanted to go out into the workforce. We reduced the size of our families, and therefore we wanted to make certain that each child's birth ended up with a live baby. We had accepted that babies died at birth throughout time and place. We didn't want mothers to die. That was really important. But in the 1980s, that changed in developed countries. We really wanted babies to live as well. And that meant those long labors, which had been perfectly acceptable and acknowledged and quite frequent, weren't acceptable any longer. And this is where Birthing Better families began to think about what is it that we could do to make certain that our labor progressed. Now, in some of the other videos, I'm going to talk about the soft skills, the birthing better skills, and those often were developed by an individual birth experience, either at the time or reflecting back on the birth afterwards. But the breathing skills were one of those skills where we tried different things and just did we feel they worked. So we knew that understanding the 4 ways that humans breathe, understanding the variations in those 4 ways, and understanding how 2 of those ways had variations that could give us adaptable, sustainable, and adjustable breathing weren't sufficient to try to make certain that our labor moved along. Now, what is the reason that labors move along or are progressive? And that's just sort of mechanical and physical. If this big object in our body can open us up, open our cervix, and move down through and out our pelvis and vagina in a reasonable amount of time, we have a progressive labor. And if that can't happen, our labor stalls. And our labor stalls because it's taking more time for the baby to stimulate our body to open up and to make space for it to move down through and out our body. And that's where the body skills began to be developed, particularly by fathers. But we're not there yet. We're in this phase of breathing, which we call directed breathing. what we know is that breath comes into our lungs. So when we're told belly breathe, it's not that our breath is coming into our belly. It's that we are expanding or pushing out our belly a little bit to let our diaphragm drop down or inflate, and our breathing is more in our belly than in our upper chest and our upper lungs. It doesn't mean the breath is escaping from our lungs, but it doesn't matter to the baby if we're belly breathing. What matters is if we can create space and softness inside the bony pelvis, because inside the bony pelvis is where the tissue of the cervix attaches. And so when we have a contraction, that contraction goes down into our pelvis and it retracts outward this tissue called our cervix. Our bony pelvis is also made up of different bones. We have the big hip bone and the bones that are over our sacrum in the back and the bones we're sitting on and our pubic bone. That's all one bone. We have one on the other side. So those are 2 bones. Then we have the sacrum, 3. Then we have the tailbone. So we have 4 bones. They're not rigid. They're not fixed, even though we think they are. And so we started to experiment with whether we could use our mind and our breathing to open up and soften inside our bony structure. Now, open up is a different word than soften. And we found that when we inhaled, we could open up, and when we exhaled, we could soften. And this became a very important skill called directed breathing. And that then buds off into communication and touch skills as well, which we're going to talk about later. So when you direct your breathing, understand you're not actually picking up your breath and moving it into your pelvis, but you're doing something with a system that is called connective tissue. That's the white stuff that we see when we pull skin off a chicken or when we have spare ribs, and there's this meat and then there's fatty stuff which is white. There's this white stuff that's covering all the bones. We know it often as parts of it as ligaments and tendons, but there is a sheet of white tissue called fascia or connective tissue that is one piece in our body. And so when we use our breathing, we can actually expand in different parts of our body by intention and soften in different parts. This isn't just around pregnancy. This is true if you have back problems, if you have neck problems, pain in your knees as well. So it was very simple. We breathe in, and as we breathe in, we intentionally feel the inside of our pelvis expand. So just do that now. Okay, so we're going to just talk about the inhale right now. Just breathe out. Don't hold your breath. So when you get better at dropping your breath into the pelvis, you will notice that the bone that moves most and moves back and out is the sacrum. It's the most flexible of the bones in our bony pelvis. So when you breathe in, feel the back of those big blades do this and the sacrum do that. Now, people ask me, how do I explain to others how much space a baby needs? Because that was a question that was on all of our minds. So if a baby is stuck, how much space does it need to get unstuck? How do we know we have a stuck baby? We know we have a stuck baby because our labor lingers for hours and hours, and women feel they're doing the same contraction over and over and over again. And if we're with a midwife, a general practitioner, an obstetrician, often they will check us and we haven't further dilated or the baby hasn't come further down into the pelvis. So all those things indicate that our labor is stalled. And if our labor stalls too long, then that's a stuck baby. And prior to medical care, if a baby got stuck and couldn't come out, the baby eventually would die, and eventually the mother would die. And that was the global goal number 1, was a live mother. They didn't really care. Traditional people, when we lived traditionally in all our cultures, if a baby died, we accepted that. Because 25 to 30% of all of our children under the age of 5 died prior to modern medical advances. We don't want a stuck baby. We need to then know how to create space, but how much space? So when I talk to people or teach people and say, how much space do you need if you have a stuck baby? Nobody goes like that. We're not unrealistic. But people often go like that. And the question was, did we need an inch more space for a baby to get unstuck? And the reality was, no, we didn't. We needed much less than that. So how do we explain this to one another? This is what we learned. Just do this. Pinch. Can't move it. Now just breathe in and expand. Don't worry about your exhale. Just breathe in and expand. One more time. Just breathe in and expand. And that's unstuck. That's all a baby needs, is for you to expand and to soften. So you've learned the expansion. Breathe in, feel the inside of your pelvis expand, particularly sacrum, which is a very important bone, which I'll talk about in another video. So what do we do with the exhale? What we do with the exhale is we intentionally visualize in our mind, whether it's a vision or we just pay attention there, to soften inside the right hip, the sacrum, the left hip, and the pubic bone. So when we're breathing in, we're expanding, and when we're breathing out, we are softening in all those places. We breathe in, we expand, and we breathe out, we soften in our right hip, our sacrum, our left hip, our pubic bone. That's directed breathing. We have to choose to do that. So I want you to do it again. Inhale and expand, and exhale and soften inside each of your hips, your sacrum, and your pubic bone. Now what I want you to do is not do that. I want you just to ignore your pelvis. I want you to just breathe the way you normally breathe. And notice that when you're breathing in a normal, what we call normal fashion, day to day, everyday breathing, constantly breathing, 99.999% of us are not paying attention to our pelvis. Why should we be? Most of us are paying attention to whether we're feeling breathless or not, whether we're doing an activity or not, whether we have a stuffed nose or not. But when we labor and want to get a big object out of our body, we need to open up and soften the area that our baby needs to move down through and out. Doing this helps the cervix to be retracted back into the bony pelvis. It does not help the birth canal. The birth canal is helped by doing direct internal massage for 5 minutes a day from 32 weeks onward. And this is another skill that Birthing Better Families developed, and I'll talk about in another video. But right now, if you are pregnant, don't do this until you're about 34 weeks. And then only do it a few times a day. When you start to have the Braxton Hicks contractions, try with one or more of them to expand as you inhale and soften around the pelvic clog as you exhale. When labor is beginning, then you can do this at every contraction and between every contraction when labor gets intense. And what happens? Labor stays more progressive. And what does that mean? It often means that the contractions become closer, longer, and more intense. And that means you need to have good breathing skills to cope, manage, work through, deal with, handle, and stay on top of increased discomfort because your contractions are more effective.